Our briefing will begin in 30 seconds.
Good afternoon. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 1,334 new cases of COVID-19. This brings our statewide total to 48,305 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. This includes 2,989 positive cases in healthcare workers. It also includes 8,827 positive cases among residents of 478 long-term care living facilities, including nursing homes and personal care homes. Tragically, 2,418 patients who have tested positive for COVID-19 have died. And to date, all of those deaths are in adult patients. As of 10 a.m., hospitals are reporting that approximately 2,674 patients are currently hospitalized with COVID-19. 550 of those hospitalized have required the use of a ventilator or a breathing machine. Across our healthcare system, approximately 46% of hospital beds, 40% of intensive care unit beds, and 75% of ventilators are still available. I wanted to take some time to highlight the work that is ongoing to ensure the safety of residents and employees of our long-term care facilities, including nursing homes and personal care homes. We have talked many times about the work being done by our hospital infection control teams and the addition of our contractor, ECRI, to consult with these facilities. Today, I wanted to talk about another group who is working alongside these teams, and that is the Patient Safety Authority. The Patient Safety Authority is an independent state agency that collects reports on patient safety events from Pennsylvania facilities, including hospitals, but also long-term care living facilities. Pennsylvania is the only state that requires healthcare facilities to report all incidents of harm or potential harm. Staff from the Patient Safety Authority have been working with our teams to provide infection control consultations alongside the department and our contractor, ECRI, to help stop outbreaks. This work is very important because we know that outbreaks in these facilities, as well as other settings such as food processing and packing facilities, correctional facilities, and other congregate settings, are an important indicator as to community spread and transmission of COVID-19. While the residents of those facilities stay at those facilities, the employees who care for them are subject to exposure from the rest of the community and counties. That's why, as we move into the yellow phase for 24 counties on May 8th, our social distancing measures will continue to be so important. We have to not only protect our loved ones, we have to take care and protect the people who are caring for our loved ones. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. If soap and water are not available, use hand sanitizer. Cover any coughs or sneezes with your elbow, not with your hands. And don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. And if you need mental health resources because you or someone you know is having a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is please stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is from WKOK. We're hearing from some personal trainers, home-based nail salons, or barbers say that with quintessential precautions, they think they could operate safely. Please tell us scientifically and medically why that wouldn't be possible to ensure safety, and what is so vexing about this virus?
Well, this is a virus that is transmitted through respiratory droplets and through the air, and then on surfaces where those respiratory droplets might lie. And even if people are wearing a mask, we have always said that my mask protects you, and your mask protects me, and then the community can be protected. However, it's not 100%, and if you're with someone in close contact for a period of time, probably more than 10 minutes or more, then this virus can be transmitted. By definition, those professionals, in addition to licensed massage therapists, provide services that does not allow for social distancing of being 6 feet away, and thus they will not be able to participate in their activities in the yellow zone.
And then as a follow-up, WBRE is asking, what is your response to criticism from the owners and employees of these businesses who insist that they are being treated unfairly in the reopening process?
Well, we don't want to treat anybody unfairly, and we don't feel they're being treated unfairly, but it is very challenging and difficult, and the governor and I have spoken about the challenges that have faced Pennsylvanians who have had to stay home, who aren't working, and very challenging and economically challenging. However, we are dealing with an extremely contagious virus and a very dangerous virus and a global pandemic. And so we have to take care of the public safety. And so we have always taken a very measured approach in terms of how the safety measures and the social distancing measures were implemented. And we're taking that same measured approach in terms of how they'll be lifted, with zones going from red to yellow and then eventually from yellow to green.
From WKOK, have you heard of anyone contracting coronavirus at the April 20th rally in Harrisburg?
We have not heard that.
And also from WKOK, the people, businesses, daycares, and everything is ready to switch, in our area is ready to switch to yellow. Why not do that partial reopening now? Why isn't it ready?
Well, we have been announcing this timeline for a while, and we feel it's very important for counties and the businesses in those counties and the public and our staff to have the announcement on May 1st and then to go from red to yellow on May 8th. Everyone needs that time.
From WJAC, what do you say to residents and politicians on the local, state, and federal level from both sides of the political spectrum who say that the decisions made on which counties were allowed to move into yellow are outrageous and looks hypocritical because it appears it was done regionally and not on a county-by-county basis, as you and Governor Wolf insisted it would be?
Well, I believe that the governor and my communications have been extremely consistent. We have been going over the last number of weeks that we were going to be talking about counties and talking about regions and counties within regions, and there is a county in the north central that is not able to go at this time because of the number of cases that they have. And so this was never going to be specifically about regions, and the governor emphasized that. As we go look at other areas and other counties that might be able to go from red to yellow, again, we'll be looking at counties and counties within regions, but it will not stick to any specific schema. I really believe that our communication has been very consistent about that, as well as the different criteria we'll be using, the metrics we were using, the consultations from Carnegie Mellon University and their modeling, as well as qualitative factors that would go into those decisions.
Also from WGAC, you and Governor Wolf said certain counties and regions could not move forward even though they met positive threshold but don't have the testing capability for contact tracing that other counties might not have. Yet you have not provided specifics as to what those levels should be. So what is the level of testing needed and how much staffing is needed for an area to be sufficiently able to conduct contact tracing?
So we have actually put out our testing plan, which has a lot of specifics about how we're going to go about our laboratory testing, as well as our contact tracing plan, and in terms of the personnel that will be working about that. And those are available on our website.
From WESB, looking at what's happening in Gallup, New Mexico, and the Navajo Nation after their restrictions were relaxed, what can individuals do here in the newly created yellow zone to help prevent a sudden flare-up of new cases?
Well, we have said all along that yellow means caution, and so we're very excited, and I know the counties are excited that their businesses will be able to have this phased reopening plan. But this remains a very dangerous virus, and this virus remains throughout Pennsylvania, and so we need to be very careful that we maintain many of the social distancing measures that we have talked about. Try to be 6 feet away from other people. Wear masks. Wash your hands. Use hand sanitizer. Everything that I say every day. All of that continues. We want people to telework whenever possible. We want retail stores to use curbside pickup whenever possible. And we want people to be socially distanced if they go inside stores. We do not want large gatherings to happen, such as in movie theaters or concerts or things like that. That's why we're not letting competitive sports and team sports continue. So we're going to be watching really carefully through all the measures that we discussed, the laboratory testing for symptomatic individuals, the isolation of positive cases, the case investigations, and then contact tracing with appropriate quarantine to occur in the yellow counties to make sure exactly that we do not have significant outbreaks as they saw in New Mexico.
From WESA, on Friday, Allegheny County Executive Rich Fitzgerald and many residents I've heard from said they were surprised that population density is among the criteria for deciding whether to ease restrictions. Is this the latest instance in which the state seems to have problems clearly communicating the basis on which it makes these decisions? Why has the state struggled to communicate these criteria consistently? And what would you say to those who are frustrated by or distrustful of the decision-making process as a result?
Well, what I would say is that Governor Wolf has been extremely clear of the different criteria that we'd be using. We have outlined the significant role of population density in many of our comments. I mean, clearly that is why our biggest city, Philadelphia, has had the most cases. That's clearly why New York City has been the most impacted city in the United States. And that population density and the transmission of a very contagious virus of COVID-19 is really part of basic public health. So we have tried the best we can to communicate our reasons for our choices, and we will continue to do so.
Also from WESA, County Executive Fitzgerald said that he thought the target of testing 2% of the population per month might be a goal rather than a hard and fast requirement. Is that true, and does that fact that the county's rate of positive test results is below 10%, which experts say is the number to stay below, give Allegheny any leeway on the testing requirements?
Well, we're going to be working towards those testing requirements. It's not a matter of leeway, but we'll be working in Allegheny County with Commissioner Bogan. We talk with her on a regular basis, and we'll be working to expand testing in all the different ways that we have discussed in Allegheny County and really in any of the counties that go from red to yellow.
From WTAE, Allegheny County Executive Rich Fitzgerald says he's hopeful Southwest Pennsylvania counties could be given the go-ahead next Friday to reopen the following Friday, May 15th. Is that possible? And what's the state's timeline for announcing the next round of reopenings?
So we're going to be looking at that now. We're going to be looking at all of our data. We're going to be looking at our metrics, the consultations from Carnegie Mellon University. We're working to see if there are any changes this week in terms of case rates. We'll be working on, as we've discussed, our laboratory testing plans and our contact tracing plans in different counties. The governor said yesterday that he was looking at the Southwest, and so we'll be looking at the Southwest. I don't have a specific date, however.
From PBS 39, this week Lafayette College reported its first case of COVID-19. College students are missing out on the college experiences, and most colleges have left open the possibility for distance learning again in the fall semester. What words do you have for students eager to get back to campus? And with the concerns about communal facilities, what factors will be considered in guiding higher education institutions for fall semester decisions?
It's hard for us to judge what the fall semester will be like starting in August or September. As we've just entered May, we've said all along that the virus determines the timeline, that we don't determine the timeline. But we know it's very challenging for students in really all grades, including higher education in colleges, that they're doing remote learning, but they're not able to be at school and to have that college experience, which is so valuable. You know, it's one of the many challenges that we're all facing in our society with a global pandemic. I think it would be dangerous in areas that have significant community spread and transmission of COVID-19 to be in a communal setting like a college. That's exactly where it would spread very, very quickly. And so we'll have to see what the data looks like throughout Pennsylvania and throughout the nation as we get into summer, and then summer tends towards fall.
From the Express Times, if the new federal government reporting requirements lead to identifying nursing home facilities with COVID-19 by name, would Pennsylvania follow suit? And is the state considering identifying those facilities before the federal data is released?
We're talking about that now. We have to see exactly what the federal government releases, and then we have to balance privacy concerns as well as the laws which regulate those privacy concerns with transparency. And so our teams with the governor's office will be weighing all those factors presently.
As a follow-up, they also ask, has the health department received any complaints about facilities refusing to release the number of COVID-19 cases and deaths?
No. No, we work very closely with our hospitals, with all of the facilities that have patients, all of the long-term care living facilities, other congregate settings, and we've had no challenges in terms of their willingness to report.
From the Philadelphia Inquirer, do you have concerns about people not practicing social distancing with the nice weather this weekend?
Well, it's wonderful that the weather is much better and much more spring-like, and so it's great that people can go outside. But as they go outside more, it's important to still practice social distancing. You need to remain 6 feet apart. If you're going to be in contact with other people on a hiking trail or on a walk, then you need to be wearing a mask. And so I think it's great that we are able to go outside, but we cannot forget with the nice weather that we are still in the midst of a global pandemic, and we need to practice the social distancing that we've been discussing.
Also from the Philadelphia Inquirer, as counties prepare to begin reopening, how far off do you think the yellow phase is for Southeast Pennsylvania?
It's really impossible to judge that. There are still significant increases in COVID-19 in Philadelphia and in the Southeast. As we've said, I speak with Dr. Farley, the health commissioner of Philadelphia, every day. Spoke with him just this morning. And we are working very collaboratively together. But we don't know at what point the Southeast will be able to go from from red to yellow. But I'm a positive and optimistic person, and I feel very confident that will happen.
From KYW News Radio, we've been getting reports of people who are being clinically diagnosed with COVID-19 but are testing negative for the virus. Why is this happening, and should we be concerned about all the emphasis that's being put on testing to stop the spread?
Well, we look at that data really carefully in terms of our positives and negatives. There are a couple of reasons why people could test negative. If they have very mild symptoms, then it might be they don't have enough virus for us to detect. Some of it might be how the sample was obtained. We know that all tests have false negatives and false positives, although the tests that are being run now in our laboratory and other laboratories are actually very sensitive and specific. There are also viruses about, other types of respiratory viruses, and it's possible they have one of those. But we're watching all of those factors really carefully as we analyze our data.
Also from KYW News Radio, can you please review the outdoor guidelines as the DCNR plans to reopen outdoor spaces? Is it safe to do? And is there a common concern that people will begin to congregate and spread the virus?
So we have actually been working with Secretary Dunn and the Department of Conservation and Natural Resources on their plans and their guidance. They're available on our website, and we have tried to craft them and then release them so that people don't come together in congregate settings, that people don't group together. We want people to enjoy the outside. We want people in the yellow zones to be able to go to state parks and those types of facilities, but we still need to practice social distancing.
From the public source, what progress does Allegheny County need to make before it's moved to the yellow zone?
Well, we're going to be looking at all the factors that we have just talked about. We're going to be discussing with Commissioner Bogan the testing and the contact tracing plans that they will be implementing, that we will be supporting. We're going to be looking at the data for Allegheny County and other southwestern and other counties as well. Again, it's not just regional. And we're going to be looking at all of our modeling, and then we will make some determinations and some recommendations, which we present to the governor. Then the governor makes his decisions.
From the Altoona Mirror, when you said you wouldn't stick to any specific schema, it seemed to contradict what happened on Friday. You stuck, except for Columbia County, to the health district schema. Could you explain this?
Well, we have, again, to repeat myself, said all along that we were looking at counties and counties within regions, and we're going to be looking at the Southwest and other areas near the Southwest, depending upon theirs. We might look at some other counties as well. We'll be taking all that in consideration as we make our next plans about which counties could go from red to yellow.
From News Talk 104.1, can you outline generally what the daily new normal looks like for counties moving from red to yellow next week?
Well, I think that starting on May 8th, when they go to yellow, that we want them to continue to, as we said, to practice social distancing. We want people to continue to wear masks. But, for instance, businesses can be open that are not essential or life-sustaining businesses, as we've talked about before. We want workers to telework as much as possible, but if they can't, they can come into work, but the business has to maintain those social distances, the 6 feet, et cetera. Our retail businesses that we have outlined can open. We prefer that they do curbside pickup, but if they can't, then following social distancing of having no more than a certain amount of people in a store and no more than 25 people in an area, that they can open and follow social distancing. And we're hoping that this will certainly help stimulate the economy in those areas and get people back to work, back earning paychecks. And so we're looking forward to this partial reopening.
Also from News Talk 104.1, what is your reaction to the FDA granting approval for remdesivir as a treatment for COVID-19?
Okay, I'm going to try to pronounce this correctly. Couldn't do it.
Remdesivir.
Remdesivir. It's always challenging. So we are looking forward to having more and more patients treated with this medication. We're looking forward to more hospitals obtaining that. We're going to actually work on guidelines and help the hospitals obtain that from the federal government. I think it's a very, very positive step. It's not a cure, so to speak. It's not a preventative medicine at all. It's not an oral medication. It is given intravenously to very sick patients in the hospital, but it's a very positive step, even though I can't pronounce it.
Our final question today is from News Talk 104.1. Are you aware of any positive COVID test results in pregnant women and how the virus impacts pregnancy?
There have been some studies of pregnant women contracting the virus. To date, the babies have been well in all the studies that I've seen, but this needs to be studied very, very carefully to check on the prenatal effects of this virus.
Thank you, Secretary. That concludes our briefing for today. Just a note, there will not be a briefing tomorrow on Sunday. We will be back with our next regular briefing on Monday. Thank you so much.